Good morning, everybody. This is September 20th, Monday, 7 a.m. in 2 minutes. I think this time
You are live.
I changed the screen. Yeah.
Oh, good.
So it makes bigger this one because last time it was
Small.
on the top. I made it big, but it was cut on the top. So now I kind of know how to do. Hopefully. So
You want my leg?
if you wanna have a break, lay down.
Yeah. I didn't shave though.
Sural nerve.
Still has
Whatever it is,
Wait.
it's far better than mine.
You'd be surprised.
This is good because I was looking for it last night, but
You know Bianchi.
yeah, Bianca, I know, of course. Yeah, I was actually even reading the articles too, but I couldn't find the grade one. But I'm a lazy person, so I
will not hear that.
But I think I was looking for the merging part.
Mm-hmm.
Sural nerve merging part. I was looking for the. Is there any arteries running with the sural nerve?
There's a vein.
Only vein, small saphenous vein.
That's right.
Ah,
Smaller
okay.
soundness.
Yeah. Or they say smaller, or they're different names. Smaller, short. Some people use short saphenous vein. Yeah. So maybe we should master like all the nerve around the ankle.
Yeah.
I think we're gonna have a bunch of records. Okay, let's try.
Need my sock?
Maybe I try first. I'll connect to Dr. Wei.
Here.
At the Dr. Wei, Dr. Aziz. Let's go this one. Jill, I had it over there.
Sorry if I moved it.
You did it?
Probably.
Can you
And then eat them.
show the screen? Can you tilt down the more? Great.
Good.
Can they see? I think they can see. Whatever.
I guess that's the
Yeah.
view, no?
Okay, we're gonna start to sural nerve, maybe then Gerard, and then I can be model too. So this is the lateral malleus, right? Achilles tendon. And then we're gonna see from here. Oh,
Right there.
right there. Can you turn this one and then change the gain? Remove. So you have to go up a little bit more to see now. Can you make change the depth? So here you already see it. But our this is the one, right? One. I think these are vein split. Look at this. You remember we had a hard time why
Yep.
there are two veins or two.
So you're saying this is it right here?
Yeah, that's the nerve. But this is the medial malleus or lateral malleus. So this is the Achilles tendon. I'm gonna show you. Are you okay? Can you see it?
I can actually see, yeah. the
Oh, that's
computer
better.
Yeah. Kind of.
Less depth, maybe that's better because if we look at the screen, much less. No.
Wait, much less.
Less. So we can. Oh, good.
There we go.
So if you see
Even do it a little more.
it has to be through two Achilles tendon. I think we have more nerve. This is the Achilles tendon, right?
Mm-hmm.
The nerve usually stays in Achilles tendon area.
And you're looking at peroneus longus tendon on top of peroneus brevis muscle. This.
Yes, that's peroneus brevis. That's longus brevis is big, yeah, big.
Yeah.
Longus brevis. And I still cannot convince myself which is the sural nerve. Right? Can you see it? It's very
I think it's right there.
that one in the middle.
Yeah, because it's running with the
Because
smaller saphenous vein.
smaller saphenous vein is more to the here now I see better. And that's
I can't see the cursor is the problem.
That's the one. So we go, if we move, it goes to the fat level. That's usually it's very nice. You see, because you remember last week when we look at it.
Should we be with the higher frequency probe at this point?
Can you give this hockey stick
Like a little one?
Hockey stick one, yeah. That could be better, right? We changed it last night, last week. I thought we had great findings, but let's take a look. Yeah, it's much better, right? So left side of the screen is the lateral malleolus, and the right side is the Achilles tendon over here. That's the Achilles tendon, right? So if we make it deeper, they can say, you're the, deeper, so we can see everything on one screen. Right side is Achilles tendon, where the arrow is, right? And I'm moving this one to the lateral malleolus. This is the lateral malleolus. So you can see parents longus, that's the longus. The bigger one in the middle is the brevis. And then you can see saphenous, smaller saphenous vein. We cleared what that is, smaller saphenous vein. And then next is the sural nerve. That's the sural nerve, I said, right? Can you change the gain? Where the error is the sural nerve.
Better?
Now sural nerve is moving. It's not. Oh, that's the one. You see it, right? You guys see it? That one.
In the middle, going toward
Yeah. That one. It's better. That's weird.
So what beyond the article
You see
says is
here.
that as you go more distal, the relationship between the sural nerve and the smaller saphenous vein becomes tighter.
Right.
As you go more proximal,
And then they spread out. That's why we start from
Makes
the
sense.
ankle.
Makes
Did you
sense.
guys hear that, right? Because at the ankle level, they are side by side. But as we move proximally, they spread out. So that's why we usually, when we look for the sural nerve, we start from the ankle area first. But I realized that I have to go a little more above than lateral malleolus, so we can see the sural nerve better. If you just stay here, sometimes it's very hard to. And then I should not compress. Look at this, it's two vein. Can you see it? Two vein
Yeah, how it's
compressible.
compressible, yeah.
That's why we had a hard time. The veins are keep merging each other. Look at this. I'm going up. Real one vein, now smaller saphenous vein.
Yeah.
We're merging.
Morning, George.
Morning.
Morning, Jordan. So this is without compressing. So that's the saphenous vein there, right?
This one?
Vein, and then the usually Achilles tendon area. That the next to that is the sural nerve. Can you move your arrow? No, that one. No, just the next. No, that's not the nerve.
Right in between the two.
Just
In
in
between
between
here.
two vein. That one. And then we're gonna go up, and they merge it. Where's the vein? Nerve goes there. It's weird here. Oh, now it's changing, right? Nerve is in the more malleolus area. Nerve, this is the nerve, you see? It's in the fat now, yeah. And then we go more. Only vein, I don't want to follow the vein.
So I'm going to read you out a line that I thought was good. Probably the best one in the article. So,
Tell me.
sural nerve runs first in the midline, then moves laterally in the distal third of the calf. We know that. During the course, it passes from deep to superficial to fascial tissues. We know that as well. Based on where it fuses, the lateral and medial sural nerves, that actually determines its relationship with the smaller saphenous vein. So if the sural nerve, the medial and lateral fuse distally,
Can you speak loudly so
Sure.
people can hear that?
If the medial and lateral runs distally, then the smaller saphenous vein typically runs in between them more proximally. And then as it tracks more distally, then they come together. If the fusion of the medial and lateral sural nerves is more proximal, then the sural nerve is usually located medial to the vein.
Medial to the vein.
Yeah,
But
so-
if they merge later, then they are running together.
Yeah, it will actually come together where they're on both sides of it, and then it'll come right to it. Yeah. But it seems like the location of where they fuse is variable. And then
Right,
sometimes
that's
it's
what I
very
was
rich.
looking for it forever.
I think Ankur's last week might have been more distal, right?
Yeah, because his was like a lower half or a little above the lower half. Here, can you see this is mine where the sural nerve? That's the sural nerve over there. In
Right
the
at the
middle.
top?
In the middle, on the top, right?
Up here?
Yeah. Where's my saphenous vein? There.
Less pressure, yeah.
Yeah, that's vein. So if I move continuously, this is about 10 centimeters. Where's my nerve? Uncle was we got familiar with his, but here is easy. We see in the middle, right? In the middle. I'm gonna
Yeah, the middle of
here in the
the
middle,
two
that one.
branches.
And then we follow this one, and then immediately go to the fat. Here still, in the middle, still in the middle. Then I cannot tell well. Yeah.
It flattens out pretty considerably.
Yeah, it almost
Yeah.
looked like it went over here.
So, oh, still there, see? Still there. Here, still in the middle. Still in the middle.
Here.
Yeah, that one, yeah, good. It's not very close, good.
As
Now,
they can't see. So Dr. Kim's scanning from distal to proximal.
huh?
We're going distal to proximal, right?
Yeah, proximal, so it's about here, about now 14 centimeter from the ankle. I mean the lateral, more to the lateral side than medial. You see it? Uncle was a good one, better than mine.
That's
I
very
blame myself now. Here, now I see down here, in the middle. I have to do everybody's, right? Because it's so.
A lot of variability, it seems.
Yeah, I don't know why. I feel like some people is better, some people. Here's a. Do I have a nerve even? I hear it's very small, right? But I see when I teach you guys, the young people, especially male, I was able to see very, very well. I don't know, let's see. I mean, hers are good too. Look at this, right?
Yeah.
This one, where the error is.
Yep.
You're gonna go up. Then here underneath of the saphenous vein, oops. Here. Here is getting smaller, right? This one.
Yep.
Now I should move a little more.
yeah.
Here flat. About 10 centimeter becomes flat.
Here, right?
Yeah. Uh-huh.
More flat.
Yeah, flatter. So
They're
that-
becoming more midline, it looks like.
Yeah.
Yeah, it's almost in the middle now.
Yes, sir.
Here. here. You can
And
see.
then it'll be interesting to see where they fuse, now that we're getting up
Missing
there.
arm.
Where the goes? Here, so we can see here. Well, looks like two branches. This one.
Here.
I thought sural nerve is so easy. That one in the middle still, right?
Mhm.
It's going deeper. Yeah.
Mhm.
So that's gonna go to the which branch? Oh, now it's disappearing. There,
Mhm.
make it deeper.
Goes deep.
Looks
deep.
like in the underneath of the gastro,
Yeah.
lateral gastro, inside of the lateral gastro. It should be. That's the one, right? Still.
Yep, so right
Yeah.
there in the middle.
Yeah.
And you take that to the edge.
We are doing very well. Still, it's not.
Huh. Where does it branch off?
So,
That should be.
like, where is it?
Yeah.
Yeah.
It's variable. So it could be proximal or distal, and that determines the relationship to the smaller
That's
segments.
what you were saying. Okay.
Yeah.
So now it doesn't move with the sarcoidosis vein, so we don't have a guider, right? Because the downstairs is move initially start with the. I didn't lose it. See, I continuously follow. Now it's in the fat level. Now it's with the vein.
Yep.
Can you put the paraflow? Yeah, so that's the small sarcoidosis vein, right? Left side is the. You can freeze this one, please. Can you point where the sural nerve?
So
Honeycomb
next,
shape. No, next to the oval shape, all of them.
I can't
Underneath,
see.
underneath.
This one?
Ani? No. Above.
Here.
Next.
To the left.
I got you.
Yeah, that's the one. That's the sural nerve and then sarcoidosis. So around here, they're still together, like about 10 centimeter. Above that is
It's split.
by itself, no vein. Like along with the, moving along with the vein.
Are we losing the vein because we have a high frequency growth and the vein's running deep?
Yeah, because it's not there. Well, we can change it by, go back
You
and
wanna
forth.
see?
Yeah.
Different?
Yep, look at us, we should take a picture of this.
It's a shoeless and sockless stay here at the ultrasound.
This is so funny. Okay, let's change the,
Thank you.
you can make yourself comfortable in it.
All right.
How do you want me to go
You
here?
have to a little
Oh.
twist it.
Okay, we're gonna
Do you want to
press
come up
start.
here, Jordan?
Yeah, maybe,
Maybe,
maybe not.
yeah.
Yeah,
Yeah,
that
maybe.
would be better.
You don't mind?
Yeah.
No, not at all.
Maybe. That would be funny.
Oh, no.
You know, look at the guy, I don't want it to.
No.
We
No,
do
no,
this.
take cramp. I just didn't want my
Okay.
shell to get on my.
Here, hold on.
No, 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 no.
Don't you need a paper towel?
Yeah, can you have a towel? Oh, towel I think is here.
Here, you
Paper
wanna
towel,
take that
towel.
under my, you wanna take it under here?
Which one?
This.
Okay. We gotta,
Oh, I'm fine. Oh.
to
You're
show.
fine.
To show people. Oh my God, your shoes is a boat.
I know. I know, I was confused.
I don't know, everybody
Sorry
feels that
if I
way,
keep
but
saying.
I should wear this scrub my pants. I was lazy. Okay. So let's say, oh, I think we have to make the, sorry.
What do you need?
That's much shallow because it's
Yeah.
very deep. I don't know why it's so deep.
I just can't see.
Amy.
Yes. Oh, thank you. Is that okay?
You can see very well though. You see? The sural never continuously moving. Oh, we have to push it. Sorry, Amy.
That's okay. What do you want?
We have to push this ultrasound a little away from him so he can see.
Oh.
Can
Oh,
you
it's
see it?
okay.
Oh, he said he can see it.
I can see.
Yeah, it's a little
Yeah,
shallow.
oh, that's enough.
Oh, that's
Right?
perfect.
That's
Yeah,
good,
yeah.
So let's say Gerard is gonna help. So here the
Lovely socks, by the way.
left
Jordan. I feel like somebody should say something.
Should we say something? Left side of the screen is the lateral malleolus, right? And then if we go up, now the perineum is popping out, right?
Yeah.
So the left side of the, you can use cursor. On the top of the lateral malleolus is the pons longus, and then that's the pons brevis. Can you change the brevis? Can you, yeah, the
You want it deeper?
gain.
Oh, gain.
Less darker. Yeah.
Good.
So good, right? So now one more time, pons longus, pons brevis, which means the lateral malleolus. And then here, Achilles tendon. Actually, here, we can see everything in one screen, right? Can you point the Achilles tendon on the right side, the far right? That's the Achilles tendon, right? In between, you see now small saphenous vein.
This one?
Yep, that's the small saphenous vein.
And
And
that's
then you
the
can,
nerve.
that's the
Sural nerve.
Sural nerve.
Yeah.
So Sural nerve usually in the Achilles tendon side, but at the ankle joint.
That's right.
So Achilles tendon, now we're going to go up continuously. Let's take a look. You can see still vein is there, right?
Oh,
That's the
that's
Sural
right.
nerve. So can you put the color flows? People,
Sure.
I'm not pressing, so you can see better actually, right? Making my box a little smaller.
How do I do that? This?
That's we couldn't figure it out, right?
I'm not sure.
So
I don't,
you know, check.
why do we just turn in the
Track
dial?
ball, track ball.
Here. Nope. Doesn't do it. I don't know.
What's not? Oh, yeah. Now it's getting me. So you can
There
see
it
it,
is.
right? That's the small saphenous vein next to the right side. In between the Achilles tendon and small saphenous vein is the, yeah, that's the Sural nerve. Can you make it even shallower, the S? So we maybe. So now we're gonna change, we're gonna see, can you get rid of the color flow? So now we are moving. My probe is actually, I don't know if you guys can see it, from more going to the middle,
Yeah.
from the lateral to middle. Still you can see. Now I'm moving. Underneath of the arrow is the Sural nerve. Sural nerve, Sural nerve, Sural
Residue.
nerve, Sural nerve. Underneath of the arrow. So now we're gonna change from, I'm in the mid calf, I'm gonna switch the probe to the high frequency one, yeah. Gonna hold this one. Thank you, and then change that.
I think at the point where you were at the mid calf,
Here,
it's
still
is
alone.
it superficial to the flat aponeurosis of the gastrocnemius muscle?
Yeah,
That makes sense.
that's it, yeah. Superficial to aponeurosis of gastro.
Yeah.
Okay.
Okay.
So let's go here. See, you can clearly see this is the Achilles tendon, lateral malleolus. And oh my God, I thought we were gonna finish all the ankle nerve today, but it's not.
Ooh,
Here, so very lower ankle you cannot. There's no differentiate. It's very hard to know. So as I go up, there's a home base coming. So if you are in the lateral malleolus, pons brevis is popping out, right? And the Achilles tendon is here. So in between two, this must be Sural nerve. Yeah, that's the small saphenous vein. That's the Sural nerve. Yeah. And then let's move that one. Oh, see now it's
it's
more
beautiful.
clear, right?
That was very nice.
Clear.
Here, let's
Can
do
you
this.
freeze one point?
Yeah, beautiful.
Oh, why don't you put the color flow before you freeze so
Sure.
people can see it? Or I can make slides for you guys.
My veins not doing a good job of moving my
I
body.
know the vein is like stop it. Can you move track ball a little bit? Then maybe track ball. Ball.
Which one?
That round ball in the middle.
Oh,
Mm.
yes, sorry.
Oh my God.
It's
Are
definitely
you
a vein.
dehydrated?
Probably.
It's so funny that it's not fire.
Yeah,
Look
like
at- look at that how.
Right?
Why don't you just get rid of that? You are not.
So is that just
Do I have
so
a
what
TBT?
what is the hyperechoic that is? So we have you see nerve just on the right of the screen, right next to the vein. What's to the left of that? What's
That
in that?
one?
What's that? What's in that? Is that just?
I don't think that's nerve or
That.
anything. So you know what they
Yeah,
say?
good question.
I don't know.
Hammock. They say it's a hammock shape. Look at this round hammock.
It is a hammock shape.
Yeah.
Yeah.
So when you look for the sural nerve, they say look for the hammock
Oh.
at the ankle.
Who's lying in the hammock?
It's round hammock. That's I think Jordan's. Let's go. See, that's fascia. That's,
Yeah,
look at that.
okay.
That's nothing. This disappearing, right?
But like
You
that.
see?
Yeah, it almost you could mistake it for.
So that's why I think always looking for the in between the Achilles tendon and small saphenous vein.
Sure.
That's the sural nerve. So we saw sural nerve here. You guys can see it. Can you change the maybe gain a little bit to show a little better? Yeah, good. So now everybody sees sural nerve in the middle,
Right there.
and then small saphenous vein.
Right here.
Good. And then teres brevis.
Over here.
Over here, good. So now we're gonna move from here. We're not losing it yet. See how
Still there.
it's so flatter, right?
It is flatter.
Yeah.
And
But
then
it's still very much there.
I'm still moving my probe to the middle of the calf. Here, there. Oh, it looks bad.
There it is.
Oh,
Yeah.
good.
This looks like it could be the
No, it's very
aponeurosis.
aponeurosis over there.
Oh my gosh.
Yeah, it's exactly. Look at, I don't know,
In the middle.
they can see it in the middle of the calf. And,
Let's see if we can
Let's
find
do
the
that.
split. Now that's interesting. What's that structure coming into view there? Those are two veins fusing right above?
It looks like it, yeah.
over there.
Yeah, go do a
So
little
if you go
elevator.
back down, you'll see the veins come apart.
Now it's two vein. It looks like one vein still.
Oh, you-
I'm going down, okay? Down.
There,
Sural
they
nerve
split
here,
there.
that's splitting too here. Right?
It's about the veins are
That's the
outside.
nerve above the vein.
Wait, I thought the nerve was here.
Yeah, that's the nerve.
Yeah.
That's what I'm saying. That's the nerve above the vein. Looks like two now.
Yeah.
But let's go on. Where's the nerve? That's the nerve, right? That's
Nerve's
the
there.
nerve. That's the nerve still. Oh, I'm in the almost, ooh.
You're in the gastroc.
Yeah, get cat in the middle.
Where, there it is.
So lateral gastro, medial gastro.
Right
In the
between
middle.
two heads.
So if
Huh.
we know that the nerve, they get together and then they only running through the two head. Tibial nerve, same thing. Posterior tibial nerve, right? Running through that two head. So that's then still one to me, right? It didn't
It
split.
looks like it is, yeah.
Oh, it's splitting now. Do you see? 1, 2. But that's maybe
Yeah.
so. I'm telling a lie, maybe. I'm moving fast, okay?
Okay. Can we try to move these pants up a little bit more?
You have to be naked. It's not 2. Here looks like a 2.
Does it?
No, but I just like imagining. I mean, I didn't know this saphenous, not the saphenous, sural nerve is going to give me a hard time. Now we know exactly, so
Yeah,
you follow from here. Ankle, follow like this, go to the middle.
I gotcha.
Let's go to the aponeurosis part. So. Did you do the casting? Done? Yes. That's why I didn't want to change. I'm sick and tired of changing. You know what?
I'll do it in the same orientation, even though I don't feel like that.
Oh no.
It's like very efficient.
So-
This-
Yeah.
Up over lateral now here.
He says you can only credit this. I realize that. But that's fine. I still go for all of
Achilles tendon.
Right here.
Okay.
Let's find the right here.
Uh-huh.
Cool.
We're in the hammock.
Hammock.
Now everybody knows that.
I like that.
Hey,
like
one more
that too.
time.
Yeah.
I like that too.
Oh, how do you say? Hammock?
I say hammock.
Hammock.
Hammock. Very
We're
beautiful.
not in a region of the country with a lot of hammocks, so we're not authorities on it.
But people love it.
Oh, they do love
So
it.
now I'm gonna help you guys to with the operating
Oh,
of the
thank you.
sound. So my sexy boy can lay flat or look at this posture. I mean, you should be on the painting something, you know. Okay. Sorry guys, you know, I'm gonna erase this one. So if you wanna watch fast. Okay. All right, let's go.
So tracking more posteriorly now.
Now maybe I can show you guys how.
Oh yeah, there you go.
Can you guys see it? So, okay, go ahead, continue.
So now wrapping around.
Go a little posteriorly. You guys can see it, right? Nobody responding this morning.
Okay, so now superficial, getting to the point of the gastroenterosis. See, that looks like it's two heads right there.
It does.
Here.
I
There's
agree.
two.
And
It kind of does actually.
Join.
Yeah, you're right. It actually does, Dr. Kim. You were right.
Oh, loudly.
You were right, Dr. Kim. You were right.
So
What's that? So
it's
we're-
like 1, 2.
so I would say this is a distal fusion.
So you know what?
This
We
is
have-
one third
There's
of the
definitely
gap.
two different ones
Yeah.
there.
Yeah. See?
Yeah.
Now it's
Yeah.
going down, right? Go
So right now we are quite literally a distal third of the cap.
Yeah.
No.
And now tracking more posteriorly, we have two heads, two
Oh,
heads.
here. One. Stay here. One. Down. 1 and 2 to me. Split 2.
Yeah.
See, there's facial line. Oh,
There's-
stay there. Stay
Right.
good. So please.
It looks like a very small pair of sunglasses.
1
Yep.
and 2. Correct? Agree? 1 and 2.
Yeah.
What is this?
I think it's still the vein.
Vein?
Yeah.
Okay, so then we're gonna color full. One freeze. This is a vein. Look at this.
Yeah,
Yeah.
because it was.
It's compressible. Let me get you more in the center.
And then relax. Oh, good. So now you guys clear. One more time. Let me
Thank goodness.
let me get the contact.
Here, let me do a vacuum effect.
Am I covering? No.
No.
Okay. So I'm gonna freeze. Oh, well, this is fine, right?
Yeah.
Because we saw the color. But
Yeah.
here, if I say, this is the saphenous vein, right?
Yep.
This is saphenous vein, and this is the
Small.
one branch,
Yes.
and this is the one branch, 2 branches. Where are we now? We,
We
are
are one third.
about from proximal 1/3 from the ankle. I hope you guys can see it. Okay, unfreeze. Let's go. So this is the vein, right? This is collection.
Yep.
Yep.
And then it looks like the nerves are running side by
Yeah,
side.
it goes.
Here.
Yep.
Oh,
Yep.
good. Okay. 1 and 2. This one. Okay. Move.
Interesting.
Yeah, interesting.
Yeah,
Walk
you
up.
can see it, yeah.
Contact goes. You go up.
But it is two separate veins. Huh.
Saphenous vein.
Flattening
Can
out,
you
and it
see
looks like
1,
one's
2?
tracking
Oh,
laterally.
oh, there's 2. 1 and 2.
Those are the
There's
veins.
a vein.
That's what I'm saying. 1 vein.
Yeah, yeah.
You are asking me where
Yeah,
the
and now it looks like here.
1.
Just deep to that. Now
Two.
I see something merging right here. It's
You
like
coming
getting
down?
closer. No, I'm coming back up proximally now.
This is continuously 1, 2. 1. But it has to be like this. I
No,
forget
I
the
don't see
which
the
one.
two.
No, here. 1, 2.
Okay.
This one is saphenous vein on the sural nerve there. Next time, everybody wearing the
Shorts.
pants with the zipper, so we can
We're gonna do breakaways like we're in
Oh my
a-
God.
You can do it.
Are you really sure?
Yeah, it's fine.
Okay, you can check it.
Yeah, I can check it.
Shall we have him change? Beautiful, look at that. Here, here.
That's deeper.
You could move it to the middle. Now still, do you see too? It looks like here moving.
Yeah.
So right now we're at basically
We're in the
bottom
in,
third of the gastroc.
in between the lateral and medial gastro. Look at this. This must be medial, this must be lateral gastro. Go up, here
Oh,
still.
that's beautiful.
Here. A couple, can you stay there? This is 2, 1 and 2. This
Oh,
one.
looks like it.
I want to stay there. Listen to me, stay there.
I'm trying.
Sure. I want to make sure that this is the vein or not. See it? That's not vein. Oh, this is the vein then. That's not the nerve. Do you guys think this is two nerve? It cannot be two nerves from now on, right? It looks like two here. 1, 2. See? Can you scroll?
I think that's a vein.
Yeah, because it was I see the
Figure
color.
is it?
Show me.
Can you follow this one if this is a common peroneal nerve branches or tibial branches?
Point to me which one you want me to follow.
Oh, let me
That's right there. Okay, that's what I thought.
Right?
Got it.
Yeah, that's the
Good.
sural nerve. Yeah.
Good, good, good. And now it's right here.
I'm covering. Where did it go?
I don't know.
It's right. It's almost like a
This one?
vertical right now on diagonal.
This one, this one.
Yep.
Oh.
Right there.
So same with the previous one. I'm gonna make it a little.
I would actually, given that it's going deeper, I'd probably switch to the other probe at this point.
You wanna change it to the other probe?
Yeah.
Hold it.
Yeah.
Oh, today we are busy. You're gonna put more down.
More gel? More
Yeah. So that's where people can sit back.
I'm gonna go distal and pick it up.
Yeah, let's-
Although I have a
let's
feeling
do
I
that.
see it right now.
Here,
Do you guys see it in the middle of the screen?
good here.
I think it's right
Is
smack-
that deep? I see what you're
Is that-
saying.
right in the
What's
middle,
that?
like a traffic light that's tilted on its axis.
Over
But
here.
tibial nerve is here, you guys know that, right?
Yes.
Tibial nerve is here. It's popliteal artery.
I'm gonna go distal and then follow up back.
Yeah, let's do that. Maybe sural nerve 4 weeks. No, it's not bad, you know. Okay, I'm gonna take it.
Okay, so we're all the way back down at the lateral mouth
It's there.
and the Achilles tendon.
Here, this is the sural nerve.
Yep.
There.
Go into the middle.
It's now very superficial in the adipose tissues.
There's a smaller
So-
saphenous vein, right?
This is a smaller sub. This is a sural nerve. Now moving.
Yeah.
Looks like two here.
Oh,
One.
it's that,
Yeah, one and,
And then it's
two.
that kind of like, it's on that diagonal axis.
Right.
So this is the lateral gastro. This is the medial gastro. Or medial gastro,
opposite,
lateral
yeah.
gastro, right? This is the medial. This is the lateral gastro, and the sural nerve was here.
Mhm.
Yeah. Okay. So let's follow the one. Which branch there was? It looks like it's split it over there. Wow, it's not easy.
No, it's not.
You should be deeper.
You think it should be deeper? It's in the muscle now.
So it's so from the popliteal fossa, when it come out, it's split. So it could be possibly lower than gastrocs, underneath of the gastrocs. not above the gastroc.
Isn't this right between the two gastroc?
This one,
Right
this
now,
is
yeah.
sural nerve
Maybe it does here.
here.
So if you kind of
Yeah.
lose
You
it
see?
like
It's
here.
going down.
There, because now it's going to go with the
Yeah.
vascular upper way.
Now they want to touch it. So this is the sural nerve. Who wants to talk?
There, you want me to move my leg out a little bit?
Sure.
So it becomes a little bit of. Go.
Jimpo, sural nerve is a pure sensory nerve. It should not to dip into the gastro.
Who said this?
Okay.
Jimpo, the Montefiore. Yeah, we understand, but when it split, we are in the very proximal part. So not from the, if you look at the, that's why I had all night looking for this nerve.
I mean, I think I see it, the bundle right there, right? In the
Yeah.
middle of the screen.
Yeah.
Right
Yeah.
in the middle.
Hold on a second, and let me, this one, right, this one?
Yep. So
This
we're
one.
we're high up now.
And then it moves down to,
It looks like it's about to move down and
Mm.
probably meet the popliteal vessels and such.
And we've run out of tape. We're at the level of the pants. So now we'll track distally.
so here, if we will look at it, right? The sciatic nerve comes down, common peroneal nerve, then lateral, cutaneous nerve. So I don't know how superficial that is, initially, because it has come out, right? Come out to the superficial part. So I still see this one you're looking at it, right?
Mm-hmm. We're all the way down now.
Really? Yeah, that's still superficial. So it's gonna be
Now we're all the way
atlas
down.
tendon here, so sural nerve should be this one. And I cannot see from here. I wish we have this is a bigger room, but I don't know what setting is the best setting. I don't think anybody showed like a full sural nerve track on any ultrasound on YouTube. So let's just follow. Can you put a little more?
Let's do this. Let's do a gel runway. I learned that from Thursday night. Dr. Kim, would you like to sit down?
They keep talking to me. I think Amy, you come here because here sural nerve. Now we are much better than before, right? We're following very well. Become flatter in the middle. It's going a little bit down from
Yeah.
the skin. Here in
That's
the middle, right?
basically
Yeah.
at the edge of the gastroc.
Yeah.
At the distal end. Now they're coming in.
No, I still put it in the middle. Yeah, it's not very skin level. It's in between the, absolutely between the medial and lateral gastrocs. Here. Here, you see it? You still see it, right? Yep, still see it.
And they kinda
So
must
it's
turn.
like
They must-
in between the two gastroc head.
Yeah, that's
Continuously,
exactly what it looks like.
continuously.
And yes.
Yeah, here now, right? This one. And then where did it go? That one, right? So it's going in, going down.
It's going down now.
Yeah, we're almost at the gas. I'm sorry, his pants is. Yeah. So we kind of know how to track up, but still don't know exactly where it's merging. And then we have to find the two branches, medial and lateral. Better than last week.
That's the goal, isn't it?
Every week we are improving.
Are we always testing the medial branch then on EMG, or
You're actually-
should they be together?
At that point, I think it's
Can you
mixed.
see it, Amy?
Yeah. At that point, it's
Follow
mixed. But
continuously.
the short answer is,
Continue.
I think if somebody has a truly very distal fusion, you might just be doing the
Go a
medial
little
branch.
bit.
Got it.
Yeah. Good, very good. Now we're all doing well. Okay, put it in the middle. Perfect. Continue.
I got it, Joe. It's fine, we can see it.
But if you just put the probe, can you tell what it is?
I don't, just doing like this,
Right?
I don't
Yeah,
know where,
no,
I don't
there's
think
no
I'd
way
be
you're
able
gonna-
to see.
No, you have no idea.
Yeah.
No.
Can you, yeah, continue. Now it's in between the two heads, yeah. Yeah, over there. Yep,
Almost to pants.
almost. Now come back to skin area. And still skin area. And at some point it dives
It
down.
must dive here.
Yeah, so the other one looks like one was diving, right?
Yeah.
This time it's not diving. So that's the maybe medial one. Some Jimpo wants to talk to me again. It's interactive in some way.
Yeah. Do you want to try, Jordan?
Sure.
Yeah, you should try. You can try by yourself.
Yeah.
Oh,
Yeah.
yeah.
Because,
Give it a Joe.
Yeah.
you can speak loudly. Why you have to?
Okay. So.
This time is Hana.
English. What happens?
No, the Jimpo sent this picture, but this is just a part of that one. Gerard, you read the article, so can you make it clear? You read the approximate. Doesn't matter, I can see very well now. Now in the middle, right?
Yep.
You think there's two branches now, right?
I don't know.
What? Can you stay there to see if there is a... Sorry guys. Here, now you're here, right?
So I just want this one
Do
again.
you think this is the vessel?
I do.
Let
Yeah.
me color flow. That's vessel. I can see the...
A little color.
Yeah, a little color now. You're still very dehydrated. Also now balls. Very dehydrated. Oh, sorry guys. Look here. We see it now. I see it. Where is my cursor? This one, right? This one? This one? Yeah, here.
Sorry, this one. This one.
Go up and down first, so you can see. Here. This one. This one.
There, it looks like it's dived.
No,
it's
I
still
would.
there.
Oh, still there, still superficial. Jimpu, you are right. We still on the
But then
superficial
it's-
level, and then we go here. Stay here. This one, right?
Okay.
And then go ahead.
And then further up.
Is this the one? This one. Oh, it's coming
You
here.
think so?
Oh, I think so. Move down there. Here, right? Here.
Right.
Going up, going down.
I'm going down now. You want me to go back up?
So this is getting triggered.
Yeah, so now we go back up.
Here, stay here. You,
It's in between the two heads where we
yeah, this one. I'm gonna. Can you just
we
stay
think it's
there?
more superficial than we did.
Or tilt a little bit to make it better.
I guess we're thinking it's
So,
not diving down.
We agree that these guys, look at this. This is the sural nerve, right?
Yes.
Lateral gastrocs. And this is the medial gastrocs. So what
Yep.
did you say?
I was wondering, do we think it's more superficial than we did before, or the same level?
This is a superficial thing.
Yeah.
Yeah.
Yeah, but
It's
I
at the
think
level of the muscle bellies.
you remember,
Yeah, all the way up here.
but my question is, here is all the way up, right? Is this the merged one? What this is from the tibial one? This is from the common peroneal one?
We don't know
That
until
we
you
don't
know.
know.
Yeah, we don't know yet.
Well, we're gonna continue until we know.
We have to do the same model.
No.
We cannot switch up the model.
No. Here.
Actually, this is the last week of the rotation.
It is.
Really?
Yeah, so I'm here next block and I'll
So I'm
continue doing
gone.
this, but
You gotta go away? Oh my
When I come
god.
back, but I'm gone.
Here.
let's go to Helen Hayes.
Stay here, stay here. Look at this. And then can you scroll down? Down, down. I'm looking at down here, looking at here, looking at here, looking at here. You're coming down,
Yeah,
right?
put it down. Somewhere out in there right now. I don't know where it went.
Here.
Yeah.
This one. Okay. This is letter.
Yeah.
This one. This one.
Right.
We should see better.
Should see better.
On here, right? This one?
Yeah.
Okay, continue. 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 Looks like split. Something here is splitting. Oh, it's very low
It's gonna
though.
be difficult. Okay.
Yeah.
Maybe somewhere
How?
else. You take
Yeah.
it. Yeah. I don't have that
Yeah.
range.
I know. My hand is saying things. See here, we see very well here. Yeah. Now we are at the ankle. So we kind of know, but maybe we are doing too much. You guys, what time is it?
It's home week.
50. You want to take a look at Plantar nerve?
Yeah, let's do it.
Yeah.
Happens.
Can you hold this? Yeah. So we're gonna. Can we have the towel? Yeah. So he can lay.
How do you want me to lay?
Lay
Flat?
on the back.
On my back.
I think so because we have to go. Oh, this the pose is opposite pose. You have to do it.
Okay. Oh, so you just want my foot to go
Because
like
we have to
this?
do medial side, you know.
Yeah.
I feel like I'm working at the brain. You know, rubbing the skin.
We're good. It'll be
I'm
fine.
there
I'll-
once a month, Dr. Kim.
You do?
I know it well.
Oh my God! You
Yeah.
guys are so
I
funny.
live in Fort Lee. There's one like legitimately every couple blocks.
Usually, you know, it's that's very like routine in Korea. Everybody goes to the public bath.
I'm
and-
surprised you haven't commented on my skin quality. This isn't by accident.
Yeah, that's by accident. Okay, you go. Maybe we do
You
this.
try
Oh,
it,
no,
yeah.
no. Then it has to take.
You want the other side?
But we have only 10 minutes. So medium size is this one here. So we have our home base is what? Posterior tibial artery and
I'm getting nervous
oh,
there.
yeah. Oh yeah. That's what I'm trying to say. So I think it's hard for me to come up with that one because I was not born here. I didn't go to medical school. So. But Tom, Dick, and not and Tom, Dick, and
Very nervous.
Harry. So
I'm very
posterior
nervous.
tibialis.
Very.
Yeah.
So medial hamstring, medial malleus.
Yep.
First one is the posterior tibialis. So this one is going to be posterior tibialis. Then this is going to be dick, flexor digital longus,
Mhm.
and the N, which is the artery, posterior tibial artery. N is the nerve, right?
Right.
So posterior tibial nerve.
No. A
And
very
nervous,
nervous
Harry.
is artery, vein, nerve.
That's what I'm saying. N.
She's saying posterior tibial nerve. She's saying tibial
Nerve name, nerve name.
Tibial.
Tipping. It's still right there. It's still
So, yeah, so the nerve, but when we call the posterior tibial nerve when it comes to here, we don't call it tibial nerve, we call it posterior tibial nerve.
tipping. Okay.
Can you find out?
I have it open.
Is there still tibial nerve?
I think it's still tibial nerve. Yeah, because then the tibial nerve becomes the plantar nerves after it passes through
Yeah,
the
but I think
flexor.
we call that posterior tibial nerve. Anyway, We'll figure it out because that's the way I remember.
Yep.
And then nerve is here, I think. This is the nerve, or this is the nerve.
It looks
Then it has reflex hallucis longus.
Only one way to find out. Can you point with your?
So we're gonna let the cursor. So this is the posterior tibialis.
Is it?
This is the
Yeah.
Nothing.
what?
No, keep going.
Yeah, this is the medial malleolus. I never took a look at this nerve, but medial malleolus, right? Then this is the posterior tibialis, thumb dick, which is what?
Yeah.
There's your drawer.
Flexor
This
digital
drawer.
longus, and then thumb dick and artery. And the nerve here is very hard, right? All of a
I
sudden,
think it's
like
tucked
this
right
one.
behind there. Yeah.
This one, right? This
And
one
then-
nerve, or this one nerve. We're going to take a look for now. So we have orientation. And between the flexor digital longus and flexor hallucis longus, the nerve is there and artery is there, right? So this is our home base. So remember the guys, this is the medial side, the medial malleolus. Okay.
For instance, I know that at that point, that's the posterior tibial artery.
Right.
Yeah, artery is posterior tibial
I don't know
artery.
if the name of the nerve changes or not. I'll have to check.
Okay, now the nerve's very obvious.
You can Google posterior
That's-
tibial artery is existing, and the nerve is existing.
The nerve's very obvious here.
Here. Oh, sorry. I'll show you nerve, obvious nerve here next to artery. Can you put the color flow? Yes. Now you're alive. That's the artery vein. Color is different, right?
Well, that's definitely the artery, and then the vein's still struggling.
Yeah, vein is. Can you press down?
It takes a little while for everybody to wake up.
So actually, this is the vein. It's cholesterol.
Oh.
The struggling
Yeah.
part is the vein.
Yeah.
Artery is downstairs pumping, and the nerve is over there. This is the. Okay. So I'm gonna get rid of color flow. Move. Nerve. Oh, stay there. Can you stay there? So this is the nerve, vein, artery was here, right? So this is still flexor hallucis longus, right?
Yeah.
Okay. Continue. You're coming. So you already passed the retinaculum, flexor retinaculum is all the way gone. We're gonna go actually downstairs where we're coming up. Here. Tibial nerve. Tibial artery. If you go all the way up here and then they split it into fibular, it's going to come to the top of the artery. They merge together, right? But you want to go down, try over here more at the ankle area to plant nerve. Go move a little fast. Looks nice. Tilt a little while you're coming down. You're at the ankle.
I am just about the ankle.
Very big.
Alright, back.
Look at
Back
all
to
the
the
vessels.
ankle.
You're still alive. Now good. This is
Now
our
you
home
want me to-
base, right?
Yeah.
Let's try one more time.
Oh yeah, that's nice.
So this is the posterior flexor digital longus, hallucis longus, in between artery, nerve. This is the artery. You think this is the artery? Let's.
No.
Are
I
you
think
still
you were right.
stay there?
I think this one's the
I didn't-
artery.
Let's see.
The
Compress.
artery should be
It's hard to compress
Closer
because
to the
I'm in the
medial
middle.
malleolus.
This is the artery.
You think so?
compressed. Well,
I
you
think
need the
it's
hockey
this
stick to
one.
This is
compress.
collapsing.
Yeah, I'm in the middle of
This
two
one.
bony structures.
This is
I'm trying to
I
turn.
think that
collapsing.
one's the
This is
artery.
not collapsing at all.
Yeah.
And then we put the color flow.
That left seems to be compressing more.
This one?
Yeah.
This one is
Yeah.
compressing.
It's
This one.
compressing more.
And then I'm gonna get rid of that. Try one more time. Put your yeah, you did
Yeah,
it. You
yeah.
did it.
I'm really
Nice.
turned though.
Nice work.
Wow. Yeah,
Good job.
she twisted her.
I had to.
Smart.
Yeah. You're the beast.
So it's the top one now. Yeah.
The name is always. there's posterior tibial nerve.
Okay.
Posterior tibial nerve is the branch of the sciatic nerve.
So what is is there a different?
The nerve.
Yeah, I'm saying, what is the difference between tibial nerve and posterior tibial nerve?
I was looking why they took the posterior tibial nerve. Some people put the deep peroneal nerve as anterior tibial nerve. It goes to the anterior, right? This deep peroneal nerve. And then some people say, I think that's anterior tibial nerve. We will find out. Because I was looking for the answer.
Crazy.
Why they took the name like this. Because I thought this is tibial nerve. I should not say it too loudly.
I have a tibial with, in parentheses, posterior tibial. So that could just be convention.
Makes sense, right? Because
Yeah.
tibial nerve, they changed the name posterior tibial nerve to say anterior tibial nerve is deep peroneal nerve.
That's crazy.
Anterior, yeah, there's anterior tibial nerve.
It's confusing though, because that's not the nerve origin.
Tibial nerve is, that's why it's very confusing.
That is confusing, I don't like
But
that.
it's a good thing that we are double checking.
That's what it's all about.
So when we go all the way down now, we go past, is it like very obvious the plantar nerves? Or not so much.
Well, next week we're gonna talk about a little more about.
What do you do with the plantar nerves? Do you block them? Or
That's
do
what you guys do. Yeah, they do plantar nerve blocks for someone, because I think that's the most common compartment syndrome at the ankle,
Okay.
plantar nerve
Yeah.
compression. So the patient comes with a tingling, but calcaneal branch is before the tarsal plantar nerves
Yeah.
go underneath.
the flexor right neck?
Yeah. So I can plantar retinaculum, right? Flexor retinaculum. Before that, calcaneal branch goes to the calcaneal area, but most of them, like all the tingling toes, the lateral plantar nerve supplies all interosseous muscles. So
Just practicing.
yeah,
Do you want this
practice.
one?
Yeah, let's try this one. Yeah.
Sure. You try.
I would. Alright.
Because we still have a saphenous nerve, and then anterior.
Alright, so I have my,
It's 8:01, just saying.
Patient. Oh, good. What is this?
Flipped it.
yeah, I did.
Oh yeah,
It's
don't
okay.
flip. Don't flip. People still.
Now-
Oh my
now
God.
it's very
Oh,
obvious.
Look at us.
Wow.
Yeah. Okay, so let's start with the medial malleolus. So can you show the home base first?
That's
Okay,
not
so
all that
I'm
is.
gonna make it a little lower. So this is the, guys stay there. This is the posterior tibialis, and this is the flexor digitorum longus, and then collapsible, and this was collapsible. So this is the posterior tibial artery. This one is a lot better, right?
Yeah.
And then this is the,
Whoa,
oh my
beautiful.
God,
Whoa.
tibial nerve. Oh my
Honey,
God.
calming.
Gorgeous.
Wow.
That should be in a textbook.
Yeah, hold on a second. Let's take a
Stunning.
picture. Stay there, honey. Stay.
Textbook.
Stay there. Boom. I took a picture. And then another. Hold on a second. I'm gonna.
Here, let me do one
color
compressed.
flow.
So that's
Yeah,
actually easier
yeah.
to see.
Okay.
Wow.
Color flow.
Oh.
Okay. Another one. This time you're gonna collapse. The press down.
Yeah. Much easier.
Wow.
Look at us. Wow. We're never gonna go home today. Okay. So. Oh, we're having too much fun. Oh my God! Look at the nerve. You are nerd.
I guess so.
Wow.
Okay, so let me track it this way.
Let's watch.
Yeah, that's
Hope
it.
that's
Okay,
much
so-
better than us.
You have to split. So, see, split it here. Look. Oh my God. Hold on a second. To take a picture, this is the splitted one, right?
Words or what?
One and two. So which one is the medial side?
The medial
Right
side.
side is the medial. This is the
Well, I think
medial.
it's gonna be different.
This is the medial. This is the lateral.
No,
Let's see.
medial is the right side, yeah.
Yeah.
Right?
Okay.
Because that's off and that's
Uh.
supposed to the left.
Oh my God! Look at that.
Wow.
Wow! Somebody's nerve.
Hold on. Let's
You
see.
make me happy because Sural nerve did not behave today.
No. That's
Plantar nerve.
tougher. This is.
I didn't expect to. We're gonna see
Well,
this
we'll see.
beautiful
We'll see.
planter.
Yeah, yeah.
Bonus is on the way,
That's,
Jordan.
thank you. I'm waiting patiently.
Patiently. Oh my God, did you see that too? Guys, we will smile together while we're left together.
Oh, it's tough to. It's
Oh, there
very
we go,
easy
there
up
we
here,
go.
It's
right?
very easy there, you're right, and then you lose it.
Can you guys see? I think they can see ankle too.
Okay.
Yeah. See? They can see ankle too. Woo! What nerve is this?
Oh no.
Time the truth. Go back to ankle.
Look at the depth. Look how, because you now have all the plantar fascia.
Right.
Oh my God.
It
Oh,
does.
oh, oh. Oh. That's the media branches. Media. So there's.
Is that it right underneath? Yep. Yep. That's
Yeah.
medial.
Hold on a second. Stay there.
Can you increase the depth?
Let me just. That's the.
Definitely.
And then we're going to
Yeah.
put the cursor. This is the.
That's pretty much it.
Yeah.
Just at the level of the.
Median?
Isn't the hyperechoic stripe right above that the flexor retinaculum?
That's the median.
Could be, yeah.
Probably.
Okay.
Right
Or am I too
spot.
far?
This is the median, right? This one?
No.
Here?
Yes.
Okay. Okay, on freeze, go ahead.
Could be. No,
Yeah.
you're not in the right spot.
Maybe give him some depth.
What did you guys
I
study?
need, Dr. Kim, I need to.
I don't care. There was here. Here. This one, right? Left moja. This
I
one.
have a lot still. That's it. Hyperechoic right there. Right
That
where,
one,
right where the
that
white
one.
line
Yeah,
is.
where is the midline? This one. This one. Can you make it better? You know what? Next time you guys
I know
might
why-
take
I
a
know.
look at Sural when you plan.
I know why this is tough though. Once you get to the
It's-
sole of the foot, you have anisotropy
It's
because the overlying structures are so dense.
Yeah.
Right.
Yep. And also this is like a moving away from the scanner. What is this?
Yeah, what is that?
That must be
something-
lateral.
That's it. This is medial coming to the surface.
This one. No, we see different one. This one.
Hold on, I'll track it back.
Yeah, let's track this one back. That must be. Wow, it's so big compared to Sural.
Deep,
Oh, it's
deep
going
dive,
down.
dive.
Must be lateral one, superficial branches. Because it supplies the sensory too. Where did it go? This one. Sorry that I
I
didn't.
think I see it down there. Down.
Here? This
Yeah.
one? This one?
Right there.
And let's see if
Here.
see if I can trace it back up.
Oh, here.
Yep, that's it. If you degain.
Okay, let's go a little bit.
Yeah. Yes.
Yeah, so that's
Okay,
medial.
So
That's
that's
medial.
medial superficial branch. It goes to the sensory branches. It gives more time sensory.
So it goes deep, tracks deep, right, and then you have to basically trust that it's there because you can't see it.
Right,
Here, see
yeah.
here. We still see.
And then
Here, here.
now it's coming to the top.
Move
And then
to-
neurovascular
move
bundle.
to the other side. Here. Oh.
It's right at the top of the screen.
Already went there?
Yeah, because
Are
we're
you
11
on the
centimeters down.
Are you on the elevator? Are you on the elevator? Move very fast. Here.
See it diving
Here,
and now it's
here.
going back up? Yep.
It's diving. Can you show the diving part? There. Here.
Yep.
Patients here.
Okay. Patient is here, guys. Thank you so much. Go. Plant is more
You have to
fun.
put it back. You have to put it back where we found it. There you go.
Oh.
We found it at the medial now. We have to put it back.
Yeah.
Cool.
This is set to.
Thank you, Jordan.